Okay.
All right. Well, thanks everyone for coming today. It's a pleasure to be here and just a chance to kind of share about this project they did a few years ago, and it was just a project that was always been, one of the things I'm real thankful to have had the opportunity to do, and I'm still real proud of the chance to do it and the folks that I got to meet along the way. So. Wanted to kind of, thanks for the great introduction. So I'm a family doctor, so my day consists of, at this time, I see folks over at the Baylor Clinic Medicine group over at Baylor Clinic, and so mostly adults there in primary care. How this kind of background to this project, this interest. I was a Baylor medical student, graduated in 2001, so ways back, and Dr. Lomax, who's part of the institute here, gave a lecture on spirituality. And so as a student, kind of approached him and wanted to get involved, and had a chance to kind of do some projects with him that he kind of directed me to. And then in residency in California, we did a rotation with 12-step groups for adolescents in Orange County. And I already had kind of the interest of doing research in spirituality and medicine, but hadn't really found kind of the niche of where I was going to pursue. And so there, kind of had one of those light bulb moments, I guess, where the folks, the adolescents were there. They were saying, "Well, I don't know what to pick for my higher path. I don't know how to engage in the 12-step here." And some were telling, "Well, I'll just pick the doorknob or the ocean," and then kind of moved on, from that. And so that kind of was the idea of like, well, here's an opportunity where I think especially some of these kids that I get a chance to meet, they had an interest. They wanted to figure out what to pick for their higher paths. They're working through the steps. And so that's why kind of the start of this idea, or the wanting to do this study, was a way of helping with that, perhaps would help with their recovery and their success. So I wanted to do it in residency, and there's never enough time to do anything in residency, and so that kind of led to some finishing up that and looking at what I was going to do next. There was an opportunity to come back to Baylor, to Houston, to do a primary care research fellowship with Baylor College of Medicine. And so along the way, I'd gotten married, and my wife had moved out there to California. And I wasn't so sure I wanted to move back to Houston again. In the summer was the first time I did it from San Diego, coming out there to Houston. But I knew more what I was getting into the second go around. And so I remember it was worth it. It was this project that I wanted to do, and there was an opportunity that was going to give me enough time and some mentoring, some folks are going to help me along the way to do it. So I came out here back in 2004 and kind of had the opportunity to kind of study up on the literature, look for a center to do the project. Ultimately, found the right step, which some folks are here today from there, and that has been a great organization to get to know and to work with. So, I wanted to kind of present some of the result of all that. As a 3-year research fellowship that I did, it became my master's thesis. Ultimately, was able to get the work published, and come to this point, wanting to still take that next step of getting further funding to kind of look into follow-up studies of it. So this is kind of presenting some of that information along the way, and then the results of the pilot study that I did at that time. So let's see, let's put this here. So I'm going to start with first some factoids. I know some of you are well versed in all the literature, but I think it's just kind of helpful to just look at how big of a problem this is. There's estimates about almost 10% of the U.S. population with substance use issues. Most of the cases start in individuals younger than age 21, so it's a big problem. It starts early. The cost of it, when you look at expenses related to lost productivity, treatment, the social cost of all the things that go around it, well into the billions. So it's an expensive problem. It's a big problem. When you look at how you deal with it, a lot of alcohol-related and drug-related issues, folks end up, incarcerated because of it. The cost of incarceration is 7 to 1 greater to incarcerate versus treatment, especially when it's in the outpatient setting. So there's a great way to try to help folks. It's more cost-effective to try to help them, before the problems keep escalating. So let's see here. As we look at different treatment programs, one of the first things that that I wanted to do was a review article. So I looked at the different treatment modalities. I had an interest in spirituality, so that kind of leads into looking at those definitions, looking at the different ways that one of the first papers that I published on this with some folks at Baylor was looking at different treatment approaches. You have a spectrum from like rational recovery is an example of a non-spiritual, non-religious recovery type of program. Then you have the 12 steps of AA, which is a spiritual but not religious program. And then you have programs that are spiritual and religious, such as Celebrate Recovery or other faith-based ones that have a defined definition for the higher power along the lines of a religion. So AA, for some individuals, spirituality is an important behavioral component that's woven into other aspects of pharmacologic, cognitive, social, and environmental factors. 12-step programs were established in 1935, and it's a spiritual but not religious because they define a higher power according to their own understanding. So looking at definitions there, this was from the paper that I published with some of my colleagues. Looked at spirituality as a broad term encompassing views of higher purpose, meaning, and value. Religiosity referring to a specific organized belief system, and religiosity the degree of involvement. When you look at folks that are in recovery, it's about half of those are in a self-help group. And you look at abstinence success rates, it's kind of all across the map when you try to look at it in literature. There's so many factors that kind of come into play of you can't really pinpoint, you can't really rate programs based on their abstinence success rates anyways because the severity and the folks that are in there. But if you look at published results, it ranges kind of in the 35 to 78% year have abstinence within 1 year. So there's a large range to work with there, but that's kind of the ballpark number. So I guess you could split in the middle and say about 50-50 at 1 year are going to have abstinence. Many of you may be already familiar with the 12 steps, but I think it's worth kind of looking at it. It seemed like a great fit when you look at the topic of spirituality and medicine. Areas where they intersect. Clearly, this area, substance use recovery, is one that there's a strong intersection. 12-step groups have been around for a long time. A lot of folks attribute their success to the 12 steps and the concept of spirituality that developed there. But the 12 steps, one, we admitted we were powerless over alcohol, that our lives had become unmanageable. 2, came to believe that a power greater than ourselves could restore us to sanity. 3, made a decision to turn our will and our lives over to the care of God as we understood Him. 4, made a searching and fearless moral inventory of ourselves. 5, admitted to God, to ourselves, and to another human being the exact nature of our wrongs. 6, we're entirely ready to have God remove all these defects of character. 7, humbly asked Him to remove our shortcomings. 8, made a list of all persons we had harmed and became willing to make amends to them all. 9, made direct amends to such people wherever possible, except when to do so would injure them or others. 10, continued to take personal inventory, and when we were wrong, promptly admitted it. 11, sought through prayer and meditation to improve our conscious contact with God as we understood Him, praying only for the knowledge of His will for us and the power to carry that out. 12, having had spiritual awakening as a result of these steps, we try to carry this message to alcoholics and to practice these principles in all our affairs. So when you look at the 12 steps there, the recovery is directly linked to the sense of spirituality, spiritual involvement, the concept of the higher power. So it kind of really came as being back there and working with those adolescents at that stage when someone was saying, hey, just pick the doorknob or the ocean. It just seems like there's so much more to that question to try to help folks develop an understanding of knowing their higher power and be able to engage actively into their 12-step recovery through a concept of what's their higher power for them going to be through their recovery. I'm going to kind of just try to not spend too much time on some of the other studies that are out there, but I think it's important at least to kind of know that this is an area, there's a whole genre of research in this area. It's been looked at quite a bit, but just kind of looking at some highlights, they found just associations, levels of religiosity associated with lower incidence of substance use in adolescents. They found among college students a study that binge drinking decreased as spirituality scores increased. it said those in sobriety for greater than 2 years expressed significantly greater levels of spirituality than those who had recently relapsed. They looked at spirituality predicting greater odds of absence of heavy drinking at 6 months. So this is not a study that's kind of on an island. There's a lot of other folks that are looking at this question, trying to look at what are the mechanisms of change, the mediators of change, the things that bring about this change. And it's a somewhat controversial, complex area of research, and they're now even looking at at functional MRIs and just kind of looking at this from all the different angles possible, from neurotransmitter level to brain imaging. For me, I didn't have all those resources, so it was more pen and paper kind of scoring of spirituality and just simpler measures, and we'll kind of get into that in a little bit. But I just want to just kind of just briefly review that this is an area that folks look at quite a bit. And change happens. There's in a group there was 70% reported that their relationship with their higher power changed a great deal during the course of their meeting. So when you look at folks in 12-step groups, change is happening, especially early on. Celebrate Recovery was another program that I looked at here in Houston. I went to 10 Celebrate Recovery sites here in Houston and just did a brief survey, just cross-sectional survey looking at their confidence to resist substance use and their self-reported levels of spirituality based on the score. And so found in 91 folks in the Houston area that there was an association that as higher spirituality score, the higher confidence to resist substance use, and others have linked that to actual sobriety. So just kind of looking at also in the Houston area through Celebrate Recovery. In this test, this study, what I wanted to do was to test the feasibility of a spiritual guidance intervention and evaluate the association of spirituality and sobriety. Questions I had, will the spiritual involvement be greater after completion of the intervention? And will greater spiritual involvement be associated with sobriety? So this was kind of setting up this study. This was what I was looking to go out and try to find. My hypothesis was that participants of the intervention will increase their spiritual involvement, and that spiritual involvement will positively associate with sobriety from substance use. So kind of coming in, that's kind of how I set up the study. That was going to be my master's thesis for the UT School of Public Health. And so then the next thing I needed to do was to find a treatment population. So I kind of looked around. I needed a 12-step group and found the right step, which was really just an amazing group to work with. So I looked at adults. I was originally going to try to focus on adolescents. There's just different issues that are going to be easier to work with adults. And I wanted to try to find folks that were new to treatment, because a lot of the focus of the intervention was to help folks find their higher power, through these meetings, through the discussion with others, to try to find a way that they could work through the steps. So looked at intensive outpatient therapy at the right step. So that's where it was. Spent a lot of time over there on West Alabama, and George Joseph is the CEO there. It's a great organization. So kind of went out there, and I sat through. Basically I would attend the evening, afternoon and the evening IOP sessions. A lot of it was through one of the co-authors on the paper, Chris Davis, and so I learned a lot from him. Just kind of sat in on those sessions. A lot of the recruitment, kind of happened at the break. So some folks that would smoke would about to take a smoking break, or other folks just kind of go out there, and that was kind of my chance to kind of say, hey, this is who I am, this is what I'm doing. They could try to build a little trust, and so I sat in a lot of meetings, doing that, and that was a really good experience for me, and a great way to know some folks that were some really great people. So the design, it was this was a pilot study, just going to be a small study, one group, pre-test, post-test of a 7-week spiritual guidance intervention. There's going to be 7 meetings, and they're going to repeat in a continuous loop with ongoing open enrollment. I have the workbook here. I'm going to pass it around while I'm talking, so you guys can take a look at that. This is basically what everybody would get one of these, and so I'm going to talk a little bit about what was in that, but that just gives you an example of what essentially the intervention material was, the manual was for the intervention. So what we do is we recruit and, hanging out at the breaks during the 12-step groups. Then when someone would want to enroll, we do the consent, all the IRB things through Baylor and UT, all that official things. Do a pre-test, get their demographics and measure their spirituality. Then the 7-week intervention, and then a post-assessment. So at the end of the 7 weeks of the 7 meetings, do another assessment of spirituality, look at their substance use, and then at 12 weeks, that was always kind of the harder one to track them down because during the 7 weeks they're there, and then folks move, different things happen, and so really push to try to get in touch with them at that 12-week point to get the follow-up substance use and spirituality scores. So those are the kind of going a little bit more on the measures of spirituality because that's an important part of it. The intervention. So School of Public Health, it was a great opportunity for me to kind of have a theory-based intervention. And so the social cognitive theory is one that's out there. It's been used. The School of Public Health had one that was looking at healthy food choices, and so things that would kind of some of the constructs are outcome expectations, behavioral capability, and self-efficacy. So these are things that are related to this theory, the social cognitive theory, and it's been used in other interventions that, the one that I kind of looked at closely was one that applied it to helping folks to learn that, hey, make healthy food choices, get involved in exercise, and having some outcome expectations that if I do that, it might help me lose weight, it might help me improve my health, and then developing the confidence that I can make those healthy food choices, I can get out there, I can exercise. So that same kind of concept, the same kind of concept applied towards spirituality. So the behaviors were different. It wasn't healthy food choices, diet, and exercise. It was prayer, meditation, group spiritual participations. The center of the discussion in each of the groups was around readings from the AA Big Book, which everyone in 12-step in theory is reading that, but you find like all of us, you get a book and it sits on your shelf somewhere, and some people are going to be real diligent and go through it, but a lot of folks, it just stays on the shelf, and they come to meetings and they have a great counselor working with them, and relationships that develop. But wanted to kind of come back to that core there and kind of take some excerpts of it, because there's a lot of great material in there that I think maybe some folks might gloss over, and so I wanted to kind of have that. So it's a 12-step based intervention, to have that kind of big part of the core of what we would do in our meeting times. Or they're 45-minute meetings. So that's kind of the core of it. And then at the back in the appendices, I'd have a table of kind of world religions, looking at just major world religions, Judaism, Christianity, Hinduism, Sikhism, Buddhism, and just kind of giving a framework of what the higher power looks like in those different religions. And then from those religions, having examples of scripture from all their texts, examples of prayers from all their texts, and then places in Houston they could go if they wanted to attend an additional session of pursuing whatever their I don't know if you use the word choose your own adventure, higher power kind of thing, exploration goes. I mean, my goal was not to steer them one direction, but more to, I think that, religions have been around for a long time. There's not a reason to invent a new religion or a new sense of spirituality necessarily. I mean, that happens, of course, sometimes, but folks have been thinking about spirituality and religion for centuries. And so I thought that having a framework, an example of what religions would be helpful for folks that were coming from different backgrounds. Here in Houston, it's a very diverse population, but people have had different experiences, maybe sometimes turnoffs of religions, but I think it's still good to, I think as an adult, kind of look at that objectively and look at what are these constructs of the higher power saying for these different groups. And then trying to promote their confidence to engage in their sense of spirituality, to pray, to meditate, which could also be reading a text or memorizing it, spending time on it, and then to attend group spiritual activities. A lot of these things you guys see that it's helpful to be around others that share a common belief. So, they passed around the handbook there. This is kind of the table of contents, and just kind of looked at those subjects, through each week: world religions, spiritual writings, what the higher powers would look like from various religions, talking about prayer, attending religious service, the concept of can a higher power really change things? How do I know my higher power? How do I kind of make that selection? So the goal is really in those 7 weeks, if somebody has not had a concept of higher power for them, that you would hope at the end of that they would have that sense and then have that confidence to go and utilize that as they're working through their 12-step recovery. A little spiritual involvement log for them to kind of record or journal, and then those different appendixes that I mentioned. So as a kind of a sample of just kind of what was discussed. So there was the groups were small. I mean, they were probably average like around like 7 people. So this was not like a huge. I mean, I'm recruiting from an IOP which might range from, I don't know, 10 to 30 kind of range, the day groups being smaller and the evening groups being larger, so it's not a huge recruitment pool. And it's just me. I have, I'm a one-man show on this project at this stage of it, when I was doing it. So I'm recruiting, I'm consenting, I'm data collection, I'm running the intervention, and so forth. So there were some limitations to how big that the scale was going to be at this time. So there were smaller groups, so it was nice to get to know them, and folks would kind of get to know each other, and if someone wanted to open a group in prayer, they could. I tried to kind of be more removed from it in the sense that I'm not trying to steer towards something, but the group could, hopefully the group dynamic could kind of contribute to folks participating in that and sharing about their experiences, and in the hope that someone sees one of their colleagues, their friends that's going out there doing that, they might build more confidence that they can do it. An example of, if you've never read the big book, is an example of something out of it, kind of the flavor of it. Then he asked me if I believe in a power greater than myself, whether I call that power God, Allah, Confucius, prime cause, divine mind, or any other name. I told him that I believe in electricity and other forces of nature, but as for a God, if there is one, he's never done anything for me. Then he asked me if I'm willing to right all the wrongs I've ever done to anyone, no matter how wrong I thought the others were. Am I willing to be honest with myself about myself, to tell someone about myself? Am I willing to think of other people, of their needs, instead of myself in order to get rid of the drink problem? I'll do anything, I replied. Despite the living example of my friend, there remained in me the vestiges of my old prejudice. The world God still aroused a certain antipathy. When the thought was expressed that there might be a God personal to me, this feeling was intensified. I didn't like the idea. I could go for such conceptions as creative intelligence, universal mind, or spirit of nature, but I resisted the thought of a czar of the heavens, however loving his sway might be. I have since talked with scores of men who felt the same way. My friend suggested what then seemed a novel idea. He said, why don't you choose your own conception of God? Our own conception, however inadequate, was sufficient to make the approach and to effect a contact with him. As soon as we admitted the possible existence of a creative intelligence, a spirit of the universe, underlying the totality of things, we began to be possessed of a new sense of power and direction, provided we took other simple steps. We found that God does not make too hard terms with those who seek him. So kind of taking from that and then trying to get folks to kind of engage around them. I mean, this is a group that's already come to a 12-step center because they are open to the idea of spirituality. So it's the audience that's there. This is kind of hopefully hitting at what they're already there to kind of learn about anyway. So I've already kind of alluded there are different approaches, and this 12-step approach is not the approach for everybody, but the folks that had come there recruiting from 12-step groups, in theory, are already kind of open and looking for that kind of approach. So then just try to generate some discussion in the group. Why do you think so many higher powers and religions exist? Is it possible to have more than one? What are the characteristics they're looking for in their higher power? To try to just generate discussion and hopefully, within the group, move them forward, along their path of identifying a higher power and then getting involved in it, and then giving them assignments, to kind of go out there, pray on your own, or select a prayer, or find a book, memorize, meditate, read, attend group spiritual activities. So trying to get them involved to do that. So that was basically it. We kind of moved through it, 45 minutes, a little social time and whatnot, but kind of working through that, weekly for 7 weeks. measure spirituality, so it's another issue as you look at these kinds of projects. How do you measure spirituality? Of course, you really, it's like that, like the saying, you can't, see the wind, but you can see the effects of the wind kind of thing. And so it's a tough thing to go and try to measure spirituality. I'm not going to pretend that a pencil and paper test is even the best way, but it was an available way. It's a validated measure. There's different validated measures out there. So the spiritual involvement belief scale was a validated. Somebody else had done the study and validated it as a scale that you could use. It looks at underlying principles that are universal to a variety of belief systems. So it's trying to measure spirituality, not necessarily religiosity, by just looking at overarching themes, purpose in life, identity, prayer. Gives you a numerical score there, which was helpful to kind of do a study, but has statements. Strongly agree, strongly disagree. I can find meaning in times of hardship. My life has a purpose. From disagree to agree. I believe there's a power greater than myself. Mixes in some negative worded statements. Make sure they're paying attention and not just circling all the strongly agree. Spiritual activities have not helped me develop my identity. So it's just one way of trying to capture, to a certain extent, spirituality, and then involvement. A little more straightforward in just terms of quantifying. How often did they pray? How often did they meditate? How often did they attend group spiritual activities? So that was the measure that I used to try to quantify spirituality, if that's even possible. To look at substance use, I used kind of elements of a drug history questionnaire. Ultimately, though, because of the small sample, it's just easier just to collapse it and say, those that maintain total sobriety versus those that relapse. So it just made it easier to do the analysis that way. So collapse the groups and analyze them between those that, small sample again, 26 folks, it's kind of a pilot study, but those that maintained sobriety for the 12 weeks and those that relapsed. And did t-tests and analysis of variance that may be of interest to some of you, but just kind of just trying to take an approach to try to look at differences. Was able to get the results out, which I'm very excited about. It's great to be able to come here and talk about it. But it was published in the American Journal of Drug and Alcohol Abuse. And those are some of my colleagues that helped me, so I definitely want to thank them. Dr. Pavlik's the Vice Chair of Research in our department at Baylor College of Medicine, Family Medicine Department. Rosh Shagag was my thesis advisor at the School of Public Health. Simon Whitney, also in our group, physician in our group, and investigator in our department. Louis Freeman, psychologist at Baylor College of Medicine. Catherine O'Mara, psychologist at Baylor College of Medicine. Chris Davis ran the treatment group there that I recruited from and contributed a lot to the design and helping out the study. Rena Chet at the School of Public Health, and Tom Costin is sort of he's a psychiatrist and one of the experts in the field of developing a cocaine vaccine, and Dr. Volk was the vice chair of research at the time. Was able to go and present it at a conference, and at that conference I had a chance to meet one of the other leaders in the field, Scott Tonigan, and was able to kind of work with him and learn from him and try to apply for a career development grant with him as a mentor. And then it was the thesis at the School of Public Health. Results, 26 patients enrolled, 22 provided post-test data. Wasn't a lot of difference in those that responded and didn't return, did not respond. Majority, 54% had never attended a 12-step meeting before, which was kind of my goal. I wanted folks that were new to 12-step if possible. 62% were men, most were white, had attended college, were in the mid-30s. Polysubstance use predominated. Alcohol was identified as the primary substance of use in 42%. Other substances identified, cocaine at 27%, methamphetamines, opiates, marijuana, benzodiazepines. About 90% believed in the existence of God, and 65% designated themselves as Christian. And many were still undecided of their specific belief system, and 35% did not have an identified higher power at the start of the intervention meeting. So that's where I was, so especially those 35%, that's really, to me, an important figure there. If you think that a third of those folks that's represented don't have a sense of their higher power when they're starting, a program that's really, their concept of higher power is one of the key components of their engagement working through the steps. We looked at, over time, there was an increase in spirituality, so you can kind of see that there. Most of the increase occurred during those first 7 weeks, and many times they're kind of out of IOP at the end of that as well, so they're kind of, between 7 and 12 weeks, they're kind of on their own at that point a lot of times. And statistically, there was a significant difference between the score at the baseline and the score at 12 weeks. So there was a significant difference in those numbers. The overall relapse rate within 12 weeks was 36%. So an abstinence success rate of 64% in this group, which is sort of on par with what you see in the literature. Spiritual involvement subscore, you can look at it that way, and that was greater in those that maintained sobriety, or if you look at the total score also, that was greater. You can see that kind of graphically here, where those on the right are those that maintain total sobriety, and then on the left are those that relapse, and their spiritual involvement score was greater than those that maintained total sobriety. And doing the statistics on that also was significant. So another way of just kind of going at that is an analysis of variance, and we can probably look at that best in a table form there, where you see that looking at spirituality, that there was significant change over time in that first horizontal column, and then sobriety status, that there was a difference between those that were total sobriety and had relapse. There was a difference in spirituality. And then look at the interaction effect, that was not present. Basically, in this small study, number one, everyone participated in the intervention, so there's no control group here. There's nothing to really, all I can look at is the effects of this group that's all being part of an intervention. I couldn't compare that to a control group. I can't really say how much of these effects that we're measuring is related to the intervention, because I have nothing to compare that to. I can't talk about causality, but it does appear that that there's change happens. It would, at least in this study, there's an association of those that would maintain sobriety and their spirituality scores. So to me, it shows promise. The goal to take the next step would be to, of course, do a larger study, do multiple sites, have a control group. Control group would probably be more like usual care, so whatever they're doing, usual care compared to usual care plus the intervention. And so that's something that I'd like to do someday. Something that I've looked at grants to try to pursue that through NIH. And so if there's an opportunity, I definitely want to take that next step. I think the take home for me, this was really thankful to have had the opportunity to do this project. And the folks that you meet, both the counselors and the dedication that they have towards caring for these folks, the folks that are there recovering, you see stories. I mean, when I was there when folks sometimes didn't show up, you didn't know what that meant, and you found out sometimes that actually some of them died. And there's a guy that it just sticks with me. A guy that I was talking at the break, and then he's not there for a few weeks. I'm asking I'm like, well, what happened to him? Like he was doing well, and he was a security guard, and then he just basically just drank himself to death one day and died in that thing. So for me, it really, you can look at all these different numbers and statistics and things, but it really humanizes it when you're there, and it's like, this is someone that they're trying to help, and that kind of shook me up a little bit. Like, this is a guy, I wouldn't say I knew him real well, but I knew him well enough, and I was really surprised, because he just kind of, he disappeared, and then I asked Chris, like, well, what happened, and then he relayed what happened later on. And so so it really, substance use can be devastating, and if it doesn't, of course, life-threatening, but then just all the other consequences that it creates in life. And so the centers that are out there, helping these folks are doing a really great thing. My hope is that with this study, it contributes a little bit to the literature. I think it's a way of helping folks. It's not the only way of helping folks. 12-step is not necessarily for everybody, but for those that are there are many that say how much it did help them. So, you know, I know that we have a lot of experts here in the group as well, and I kind of wanted to maybe, you know, use some of our time for, you know, for discussion. So I'm not just the only one talking here. I'm probably not even the best expert in the room here, I'm sure, either. But you know, I wanted to hear maybe some of your thoughts, some of your suggestions, ideas, or just maybe some of your own experiences, either in research in this area or caring for folks in this area, or just some general comments on the, you know, that intersection of spirituality and health. I mean, that's what this is. This is the Institute of Spirituality and Health. And for me, as a physician, what you're looking for is, where is that intersection happening? And I don't think it happens in every part of medical science. I mean, there's just some things that, hey, you know, if the appendix is infected, you just need to cut in there and remove the appendix. Spirituality may be a part of the emotional recovery and things, but there are some clear things where the intersection happens. I think that this is one of them. You know, end-of-life issues are one of them. Hope, dealing with chronic illness. These are areas where there's some clear intersection. And so we just, you know, welcome a time of discussion we might be able to have, you know, on that regards. Anybody have any kind of questions or comments, suggestions?
I wanted to say, you know, we say the 12-step program is not a spiritual program, or it was spiritual but not a religious.
Yeah.
But it sure talks about God.
It does.
Even though it says God as we understood Him, but it's bringing God in. And, you know, it starts off, of course, talking about a higher power, but then it kind of moves into it. In my training, I had to go to spend a month in a program, and went to many AA meetings, of course. And I heard more talk about Jesus in the AA meeting than I did in most churches I've been in. I mean, it seemed like the people themselves bring their spirituality into the process, even if it's just the 12th step. So the difference in what you were bringing was of course, intentionally bringing prayer into it. Prayer.
Yeah.
How different was it?
It's a good question. I mean, I think that some of it's where you're having, which generations are involved. I mean, I think that, you know, Buddhism is a big area of, you know, for many of the folks that didn't go that went with another religion. I think Buddhism was very popular there, and, you know, I think that the 12-step framework is still spiritual, not religious, because you could work those 12 steps with a different concept. I mean, going back to that example of saying, well, pick the doorknob or the ocean, I think that you legitimately could work the steps with the ocean or the doorknob as your higher power, but I don't know that let me pick on the doorknob for a while. I don't think that's the one that you want to turn your will and your life over to the doorknob, I guess, you know, as you understand the doorknob. So I think that this 12 steps are spiritual, not religious, because you could select a religion to go through them, or you could, you know, I think there were some folks that their higher, I don't have a table of all the different higher powers that folks chose, but nature also one. So nature, you kind of look at that as a more, you know, not really, doesn't fit into any one particular religion. So I think folks that did go those routes were able to incorporate their sense of belief in a higher power into their steps and not have it be, you know, part of religion. But what I felt like I was trying to bring, in addition to what the steps were doing, was to spend a little bit more focused time strictly on the discussion of the higher power. You know, the name of the intervention was knowing your higher power, because there's only so much time that folks have when they're going through their group sessions. They're going around the room, they're sharing what's going on. This is really a focused time that we're here to talk about, you know, one, identifying a higher power, and then, you know, moving on to participate, you know, through prayer, meditation, group spiritual activities. So you look at 35% of them did not have an identified higher power coming in, so that would be sort of the main focus of this kind of intervention would be folks that don't have a higher power, that are new to 12-step, that you could argue that they would not be maybe do as well without that concept. So I think what this brought new was not changing the 12 steps or anything that goes on in recovery, but just providing an additional resource, additional time and focus towards that concept of spirituality so that folks have a sense of what to do to work through, their steps.
When I was in this training program, I heard someone say, I've always had a higher power. Higher power was alcohol.
Right.
Or drugs.
Jack Daniels.
So and the program hopefully was changing the higher power from one.
Yeah, I think that's that's kind of what the focus of the 12 steps is, and I think that this this intervention, this resource is to knowing your higher power. What are you changing your higher power to? What direction are you going to go with that? Yeah.
I'm working with people who are trying to get the message of Overeaters Anonymous.
Mm-hmm.
It's the same 12 steps, except
Right.
they changed the word alcohol to food. And, they do a lot of work with not just obesity, but with bulimics and anorexics. And it's, I'm wondering how you've been able to share this information with your colleagues.
Well, I think
That's part of what we're trying to do, educate professionals
right.
about this free service that's, not just for alcoholics and substance abuse, but for so many other things that affect our health.
For me, is trying to go about it as a scientist. The main goal was, wanting to get it, try to go that track. Can I get it published in a journal so it's out there, so it's out in PubMed and it's available. Anybody can, that's all what we all do. We jump at a certain stage of science. We try to find what we're trying to study. You try to see what's already been done. So trying to contribute to that, and so gets one way of getting out there in the scientific community. Then whether this is a resource that 12-step groups want to adopt. I think that the reality is they could adopt it, but I think that there's still the need for more evidence behind it. Is this an evidence-based approach? And so my focus more as an investigator is to contribute to evidence. I think that I give it an incomplete at this point. I give it a promising incomplete perhaps, but I would like to do more, research in the area to see what's the evidence behind, this approach. Does it work? Does it help? I think some of those questions are really still unanswered. So my angle is more going that route. I'm not necessarily trying to start my own thing or even sell a workbook or an intervention. It's mostly more the scientific thing. But so that's one way of getting the word out. And then I think that if it's a faith-based thing, then that's another way through different faith-based organizations that have some of those. I know that some churches, synagogues have different weight loss programs. I know there's First Place for Health as a faith-based weight loss program. So I don't know if that answers your question or not, but
I just think nurses, doctors, all of us need to be more aware and comfortable referring people to.
Yeah, and that's what Dr. Graham here at the institute is, and that's one of the purposes of having this institute here in the Texas Medical Center is to keep awareness out there, and then to foster scientific study and have a forum for discussion and investigation. Yeah.
Hi, I'm Anna Carroll. I work for the Right Step, and one of my jobs as a community relations director is to give tours to the Baylor medical students. And they come on Thursdays, 2 or 3 of them at a time. I think they're third-year students. I'm always amazed at how little they know about addiction.
Yeah.
Truly clueless. I'm also amazed when I say, do any of you have any personal experience with this? Most of them do not. And, when you say 10% of the population have this problem, well, I think I know all of them. So it's hard for me to believe that there are actually people who are so, in the medical field, who are so unaware and uneducated about this disease. And we tell people, yeah, it's like diabetes or it is a disease. The difference that I see, and I've been working for the Right Step for 6 years, is that when somebody goes off to treatment, they don't typically announce that in church. we're going to pray for this person, because nobody wants to talk about it. You know, if somebody's wife has cancer, the casserole, everybody's cooking in the neighborhood, and it's going around, and they're talking about it, and people are picking up their kids from school, and somebody's wife goes off to treatment for alcoholism, and nobody talks about it. You know, and it's just unfortunate, because I think more people would get help if the doctors were more educated, if it was talked about more, if people were prayed for in the churches like any other disease. You know, there's still a stigma. I don't care, as long as we've been doing this, there's still a stigma. So it's unfortunate.
Yeah, and I think, maybe not for the medical student themselves personally, but in their family. I mean, you look at through families. I think for most people in their family, you can think somewhere in your family tree, you may not know about it, but probably everyone in their family tree somewhere has someone that's had an issue. The other thing I think in the medical profession that we need to be aware is that some of us are enablers of this. A lot of us are. I mean, you look at sitting in those meetings. I was, a lot of folks in the group are receiving their medicine, their prescriptions from their doctors. So I think that's something as physicians that we have to, as we're treating pain and anxiety, to look closely to identify. I mean, some of those things need to be treated appropriately, but I think in the healthcare field we need to be aware to make sure we're helping folks in all the ways that we can. So I think there's a need for physicians to continue to learn and to be aware of the issues and identify it in the clinic, to screen for it when appropriate, and to refer when needed. Thanks for sharing that. Yeah, go ahead.
Lauren Wolfer, I'm a social worker from the Baylor Clinic. I think you said that 54% of the people had not been exposed to 12-step programs before, or had not been to a meeting.
In our group, what was the number here?
It was something like half. But I was just curious about I'm just thinking about the higher power thing trips people up a lot, even if they've been in and out of the program for a long time. So I was wondering whether, I guess I'm just asking you to help me think through, like, what might a person who's that kind of person who's been around, are they not going to be able to work through the workbook as well, or what were you thinking in terms of what that kind of person might bring to? I know in terms of you want to lessen the variables that you have to deal with, but I guess I'm just asking I want to think through this workbook. Is it going to work better on someone who hasn't been exposed to 12-step and higher power ideas before, or may have had that struggle before?
Yeah, I think that the intention would be folks that are in that point of struggle perhaps are going to be most benefited, by it. I think that in a larger study you could try to tease out, what those effects are. But I think that, for any of us, we get maybe desensitized to certain things in our life, and when you have a point of reevaluation, that's always a healthy thing. Even just kind of getting ready to give this talk, I was kind of flipping through the workbook again and kind of remembering some of those experiences, and that was a healthy thing to kind of go back. Oh yeah, you remember this story, I remember that person. And so I think even for somebody that quote unquote is I've already been there, done that, thought through it, they may be a benefit to take a moment to kind of like, well, what do I believe? What do I do? And then I think in the 12 step there's already sort of a built-in helping helps the helper kind of thing, and that's a construct where when folks are helping other people, it actually helps them. So I think that there's still a role for folks like that as they, and I saw that happen in even the small groups that were there, where to a certain extent I kind of designed it that way too, where folks could share. There's always the person that's going out there like, I'm going to do it, I'm on board, and there's the other person like, forget that, I don't even know why I signed up for this stupid thing, And so hopefully that the person that's saying, hey, I did this and it was great, I started doing this and it's really helped me, that person might be more of a leader that the other person say, okay, well, I won't admit it, but at least I'll try and see, So I think that there is still probably a role of that, but I think it's beyond the scope of what I did to measure or quantify that. So.
Because the second part of that too, I heard that your initial desire was to do with a group of adolescents.
Yes, it was.
So that's interesting too to think about. developmentally, because they probably actually need help thinking through this abstract idea of a higher power.
Mm-hmm.
So the difference between doing it with an adult population and adolescent population is interesting too. So I was thinking about that.
Yeah, that was my initial kind of my light bulb moment was with adolescents, and kind of really, for them, many of them never thought of on their own. Basically, I mean, they kind of whatever their parents told them or whatever, you know. So it's, you know, I think, and that may not, adolescents maybe too young for that habit. I think maybe early adulthood, but there's a kind of a point in a lot of people's life where they sort of consider that concept on their own, out of their parents, you know, kind of watch. Ultimately, it's tougher to recruit and do all those sort of things in that population, so I didn't do it that way. So, you had a comment or question?
Yes. I apologize first for coming in late.
No, glad you came.
I think an interesting side issue of your study and your intervention is, does it help people stay in the AA program, especially initially? My impression is that there's a lot of folks who will go to 1, 2, 3, 4, 5 AA meetings at the most, or 12-step meetings, and then they kind of drop out early. There's a whole lot of folks just coming to kind of put their foot in the water, and then they don't stay. And I'm wondering if your program might help some of those folks, especially if one of the things that causes them to be turned off is the spiritual aspect. I think some people go to 12-step programs not really aware that there's a spiritual component to the program, or that it's a spiritual program, and it's almost like your intervention kind of could help prime someone and prepare them for that, so that if they're either hostile toward religion, or they're just have never been involved with religion or spirituality in their upbringing, that they would be more prepared for that as they enter the 12-step program.
Yeah, I think you're right. Absolutely. I mean, kind of reflecting folks that are in their day in and day out. You could speak more better than I can. But one observation I had was some of the most resistant folks are the ones. Some folks were there because they wanted to be there. Some of their family members made them. Sometimes the courts made them be there. And the ones that the courts made go there, it seemed like, if I had to generalize, many of them were the least happy to be there, kind of thing. And so they were least interested in really engaging in the process. So I think absolutely that well, first of all, 12 steps is not for everybody, but for folks that are there and that struggle with the concept of the higher power, this may be a way that helps them to more meaningfully, work through their steps. And I think that some of the resistance to the reason why I chose religions, to include there, is because I think some of the resistance that maybe, many of us I'm just resistant when anybody tells me to do anything, basically, And so there is a sense where self-discovery is more meaningful and more sustainable when you've kind of thought it through yourself, considered, and said, this is the direction I'm going to go, rather than saying you need to go this direction. And when I'd say jump, you ask how high, kind of thing. That doesn't, for just human nature, I think doesn't work very well most times. So I think that this was just try to defuse maybe the religion concept to just say, but just consider the fact that these have been around for centuries. People have been thinking about it for centuries, and maybe the harder route is to try to reinvent the wheel rather than just reevaluating the wheels that are there and make those considerations. So that was more of the concept that I was aiming for.
You mentioned enabling behavior, and I just want to say I was out at Open Door Mission for about 6 months, and because of comorbidity, they had, were able to come up with a diagnosis of, bipolar. These men many of them were trying to get that diagnosis because then they could receive a check, receive a check from the government, and they would immediately leave the program and go out into the world receiving their check each month. So in a way, the system itself was enabling the process of them being able, to continue in their disease process, I'm sure.
Yeah.
Interesting how we enable, trying to help people, sometimes we enable the behavior that we don't want to enable.
And that's even that whole concept of empowering, enabling, and 12-step is sort of controversial on those that are taking the other point of view that they say, well, 12-step, doesn't, some people look at it as empowered, other people look at it, they're kind of locked into that kind of thing. And so that's beyond what I was really looking at. But when you look more broadly at the issue of substance use, there's a lot of, I think bottom line is there's probably not a one-size-fits-all method of recovery. There's a lot of methods, and I didn't even bring up pharmacologic methods here. I think spirituality is a part of it for part of the group that's going through recovery, and I'm focusing on that. But I think it's also important to have the big picture. That's not the only way, and for some people, it's not even a way that they utilize. But for those that are utilizing it, many people really say, "Hey, this was the key thing." When you talk to folks, and what was the key thing? A lot of people list spirituality as the key thing that helped them recover. So it's important, though.
Yeah. One other thing I wanted to say. Many of the men at Open Door were in their early 20s, but they had been in like 5 programs already, starting 15 on, and even bringing them from other cities. Parents brokenhearted, but trying one more time, one more way. That particular program was not emphasizing 12 steps, but was trying to be a Christian program, I think, hoping that they could restore their life from the inside out, and they would be in control. And it seemed to work, but all of the young men were reaching out for it as if this is going to be the answer for them. And I don't know statistically how many, but what I was wanting to say was, I don't think being a young person means you're any less likely to want to find answers. And if you feel like something greater than yourself can do it, you're going to at least try it. And I think they were. Many of them cleaned up, looked wonderful, and then I'd see them back a month later, and it just broke my heart, as you said. It's a devastating disease, and I don't think the public, all the way from Red Skelton, if y'all remember, Red Skelton would make a joke of being drunk on television. And we've come a long ways, but I think it's still in the closet, and I think it's still fearful. We don't don't have a lot of confidence that anything other than 12-step, that's all we've ever heard about working. And I do think many people have been rescued from their situation through to 12-step. There's no doubt about it. I know a lot of people.
Yeah.
In Webster, Texas.
What's that?
In Webster, Texas, at a place called the Up the Street Club. There's a Saturday morning, relatively new group. It's called After 9. And it's a group of people who discuss steps 10, 11, and 12, hence After 9, from any and all 12-step programs. Alcohol, Narcotics Anonymous, Cocaine Anonymous, sex addicts, sex and love addicts, gamblers, Al-Anons. Last Saturday there were about 70 people in the meeting. And that was just on sharing about step 12. And we go 10, 11, 12, 3 weeks and start over, 10, 11, 12. And it's growing because the Unity Church in League City has a Thursday night after 9 meeting. And on Tuesday evening at the alcohol and drug, whatever the center is in Houston, Tuesday evening there's a group, an after 9 group. Sure. And I've got 42 years in recovery, and it took me 36 years to overcome what I finally identified was a fear of meditation. And it's changed my life in these last 6 years to be involved with that group of people and paying some attention to what steps 10 and 11 really do. And one of my mentors has said that at one of our Episcopal retreats, said, you don't need to worry about step 12 because it'll take care of itself if you're working steps 10 and 11. And I have found that to be true in my own life. I've had wonderful experiences with 5.5 years I went to Harris County Jail, but I always had a badge on that said I could get out at night. 15 years in a hospital in Clear Lake, 3 or 4 times a week, calling on Episcopalians and drunks. And quite often they were in the same bed, and lots of other people. Somehow this mechanical engineer got a gift of being able to call on people in the hospital, and nurses would send me to people. 50% of the people in that general hospital, not counting maternity because that's different, 50% of the people that I saw in 15 years had alcohol or other drug problems either themselves or in their families. But you guys out there in the medical world have as much to do as we did in the airplane and rocket ship business. You know, I got a good friend who was treated for depression after his Apollo mission. And in his book, he said that's when they got him hooked on tranquilizers as well as alcohol. Very openly.
Thanks for sharing that. Great work that you're doing with the
It's
couple folks.
it's a fantastic life. It's wonderful to go back to page 77 of that big book where it says, our real purpose is to fit ourselves to be of service to God and the people about us. The top of page 77, upper right-hand corner.
That's all about. Before I turn over to Dr. Graham, anybody have any kind of final words?
Okay, can we have a round of applause? Beautiful presentation. Thank you so much. I want to mention next week we have Ann Cosey from, I believe she's a Baylor too. At any rate, Ann Cosey will be speaking on the health effects of sex trauma in women. Should be very powerful talk, very emotional talk, I'm sure. So if you know someone that might be blessed or yourself, come be a part of that next week, same time, same place. And thank you for being here. See y'all hopefully in the future. And remember Gerald Schroeder, a noontime talk on the 29th of this month of February, and right here also. Thank you.
I know you would.
Yeah, let me turn this on.
Well, I actually-